Joining us to discuss this is a public health consultant based in Lagos, Dr. Unsi Abasi Ekanem. Many thanks to you, Dr. Unsi Abasi, for joining us on this hour.
It's a pleasure to be here.
Nigeria ranks very low in terms of life expectancy, and then we also know that maternal mortality rate is also very high in the country, and that's majorly because of an overwhelming dependence on out-of-pocket. So how would you describe these coming from the lawmakers? Is this a welcome development?
It's a fantastic idea. I can assure you that we are now on the path towards universal health coverage. Anywhere in the world where universal health coverage is being achieved, health insurance is mandatory. Now, the reason is because everyone is captured, and we're saying health for all. Everyone must be captured in terms of healthcare provision. And even investing in healthcare, everyone must be captured. Now, what the bill is saying is that we should, as much as possible, bring everybody to the table. We should make contribution towards the national health insurance. And by doing this, we'll be able to pool enough funds and judiciously utilize these funds to provide basic health care for everyone. I'll give you an example. If we have 100 million Nigerians that can bring up 200 naira, all right, every month, we have about 240 million naira, 20 billion naira every month. And in a year, we have about 240 billion naira. And that is enough to fund most of our healthcare, facilities. Now, with this, we can be able to cater for the healthcare needs of everyone. The NHIS bill of 2004, that was implemented in 2005, excluded some persons. It wasn't mandatory. So a lot of Nigerians, I would tell you...
It did, because I know that it covers the formal sector, the informal sector, and the vulnerable groups. So isn't every other person covered in that vulnerable group?
A number of other Nigerians are not covered in the NHIS bill. And this is why the new bill is to cover everyone, to make sure everyone is captured.
All right. So whilst you agree with this, but a lot of people also say that NHIS is not without its challenges. We've seen leadership problems in the NHIS. We've seen issues around inconsistency in the NHIS. So what are the things that you think should be put in place before we begin to implement this?
That's why we are coming up with a commission that will be saddled with the responsibility of reviewing the challenges that NHIS faced and looking at the opportunities and the solutions to these challenges. Fine, you've said leadership was a problem. It is true. But now we want to see how we can repeal the entire system and build a system that will be able to work based on the challenges that was observed in the NHIS. I would say this, that the way this is going to be designed, according to the bill, we would ensure that all the stakeholders that are involved, whether the HMOs, the healthcare providers, the banks, the insurance brokers, everyone that is involved would be given a role and responsibility, and everyone must work within his or her own roles and responsibility. Now, in terms of course, the corruption that was involved where people, healthcare providers almost double the cost of product, the cost of medication, that will be checked, because according to the bill, there are measures on ground to ensure that you only provide services within, within the stipulated, regulations. Issues whereby healthcare providers will be giving false ideas and probably escalate the prices of products like drugs will not be accommodated in the new bill.
All right. Unsi Abasi Ekanem, public health consultant. Many thanks for your time on this issue.
Thank you very much.